Now, Health Ombud Malegapuru Makgoba says it would be irrational to roll out AstraZeneca vaccine in the country. This comes after the study found the vaccine has limited efficacy against the new coronavirus variant in our country. Let's discuss his concerns now. He's joining us virtually. Prof, good morning, and thank you very much for your time. From the reports I've seen at the weekend, you are very clear. You are very clear that AstraZeneca will actually be of no use to us, because even if you use it, you're going to have to vaccinate many more people than you can afford.
That's correct, Dan, but thank you for inviting me to discuss this matter. The reason why I said that there was no scientific rationale is that in medicine, you should never do any harm to people when you are in doubt of what you want to give them as a form of therapy or as a form of prevention. I think our studies here in South Africa have shown that the AstraZeneca vaccine is not efficacious against the dominant strain of virus that circulates in South Africa. And there would be absolutely no point scientifically to try and test it or to try and use it as a way of vaccinating to prevent the coronavirus infections, because they are not caused by the virus against which it has been established that it is efficacious, although it is the least of all the vaccines that have been tested for the coronavirus.
So is it correct for me to say then AstraZeneca is a lost cause for us, despite what the government might be hoping? From what you are saying, scientifically, there's no point.
There is absolutely no point for a simple reason that we vaccinate people not to prevent them from getting severe disease, but to prevent them from getting the disease. That's the rationale for vaccinations. Secondly, we have established that 90 to 95% of the dominant virus in South Africa is not neutralized by antibodies that have been, I think, found from the AstraZeneca vaccine. So what would be the scientific rationale for that? Because all our policies and decisions have been guided by science. Science is telling us that this is a useless vaccine, so why should we test it amongst our own people? What would we hoping to get out of it?
Now, you've also praised Professor Shabir Madhi and their colleagues at Wits University who did the trial and discovered that it is not as efficacious as people might have hoped against the new strain here in South Africa. But is there a possibility that we could have done things differently? Where are the flaws in this process?
No, there is no flaw, because remember Professor Madhi and Professor Glenda Gray are sought after, like other South African scientists, to undertake and to be lead investigators in this trials, the phase 3 clinical trials. So Professor Madhi didn't go around and say, I want to do the study. I think the AstraZeneca were just testing their candidate vaccine, just like Johnson & Johnson were testing their candidate vaccines, and they had to partner with different scientists in the country. So there was nothing that he could have done, and he was just doing a phase 3 clinical trial like everybody else was doing. But the important thing is, once you make the findings, you have to make the decisions. And the decisions that you make from a phase 3 clinical trials are not about speculations or extrapolations. You've got to make them from the scientific data that you have assembled during the trial, that is often blind to the person doing the study. So Professor Madhi and Glenda Gray, in their respective, I think, positions, didn't do anything that was wrong. But once they had the results, they have provided it to the public for decisions to be made. And those decisions, I think, are correctly made, that we stop the rollout and maybe send the cargo back where it came from.
So that's the way to go. Thank you very much, Professor Makgoba. Loud and clear there. AstraZeneca is of no use to the coronavirus strain in South Africa. Pack it and send it back. That's really what the scientists are telling us. There's no point at all in even trying to do it. That was Professor Malegapuru Makgoba. He's the South Africa's health ombud, and he's also a molecular immunologist.